Welcome to I Am Resident Insider. I'll be your host, Sarah Grant. I'm a PGY2 resident in internal medicine. Please feel free to follow and subscribe below to help support the channel, and also leave any comments below about videos that you would like to see in the future. The topic at hand is altered mental status. It's a very common presentation that you're going to see on the wards, and it's important to have a differential in your back pocket for whenever you encounter this situation. MINT is an acronym that I did not create, but it is a useful tool to help you whenever you're taking a history and developing your differential. It stands for Metabolic, Infectious, Neurologic, as well as Toxins. Metabolic causes include electrolyte abnormalities such as hypernatremia, hypercalcemia, elevated BUN and creatinine, as well as hypo and hyperglycemia. Organ dysfunction is important to have on your differential. For the lungs, you want to consider hypoxia and hypercapnia. You always want to consider thyroid dysfunctions such as hyper and hypothyroidism, adrenal insufficiency, as well as Cushing's disease. For the liver, you want to consider hepatic encephalopathy from cirrhosis, and for the kidneys, you want to consider uremic encephalopathy. Other important metabolic causes are constipation, urinary retention, and vitamin deficiency, specifically B1, B9, and B12. Infectious causes happen both within the CNS and outside of the CNS. CNS causes include encephalitis, meningitis, as well as abscesses. And outside of the CNS, you want to consider sepsis, pneumonia, and a UTI. For neurologic causes, I included stroke as well as hypertensive emergencies, non-convulsive seizures, tumors, subdural hemorrhages, hydrocephalus, especially in elderly populations, trauma, dementia, autoimmune encephalitis, dural venous sinus thrombosis, as well as delirium, which presents with a waxing and waning presentation. Since strokes do not predominantly present with an isolated altered mental status, they usually have a focal neurological deficit associated with the presentation. But rare causes of stroke that can present with an isolated altered mental status include frontal strokes, non dominant parietal strokes, which is the right side, thalamus, and brainstem. Dementia is also important to consider, both acute and chronic presentations. For acute presentations, you want to consider prion infections as well as CNS vasculitis. And for chronic presentations, you want to consider Alzheimer's and vascular dementia. For toxins, you want to consider both excess and withdrawal of medications, both prescribed and illicit. For excess, you want to consider anticholinergics, steroids, sedatives, anti-seizure medications, illicit drugs, and baclofen. And for withdrawal, I included alcohol, benzodiazepines, as well as baclofen. Other key causes are carbon monoxide and heavy metal exposure, such as lead and mercury. Please feel free to pause the video here. I wanted to create a summary of the entire MINT differential that shows both the metabolic, the neurologic, the infectious, and toxin causes all on one slide. I also wanted to show how time course could be quite helpful in differentiating the cause of altered mental status. For hyperacute presentations that happen within seconds to hours, it's very important to rule out ischemic strokes, intracranial hemorrhages, hypoglycemia, as well as overdoses, all of which can be quite fatal. For acute presentations, you want to use the MINT mnemonic noted earlier. And for subacute presentations that happen within weeks to months, you want to consider rapidly progressive dementia such as prion disease and vasculitis, as well as meningitis and encephalitis. And for chronic presentations, you always want to consider dementia, which falls under Alzheimer's and vascular dementia. I also wanted to show an order set of things that you can create either on Epic and Cerner and create a little folder to help you quickly put in orders for any patient that does present with altered mental status. I included a CNP for electrolytes, CABC to look for infectious causes, ABG for hypoxia and hypercapnia, AccuCheck to quickly rule out hypoglycemia, cortisol levels, TSH and free T4 for thyroid, B1, B9, and B12 levels. For infectious causes, I included HIV, syphilis, RPR, a line panel, and for infectious causes, you can also include sputum cultures, blood cultures, urine cultures with urinalysis. And for toxic rule out, you can consider urine drug screen, heavy metal panel, as well as ammonia level. And I included a copper level as well. For imaging procedures, I included a chest x ray, a CT head without contrast, and a lumbar puncture. Ciao, thank you for following along, and hopefully you learned something. All right, come see this version.